Right now, more than 18,000 people live in Osage County. And of those 18,000, if just one has a stroke tonight, the odds of them surviving are not high. Data collected by the Centers for Disease Control and Prevention lists Osage County as the deadliest county for stroke victims in Kansas based on its population. Well, that number didn't sit very well with a few folks living in Osage County, which is why they contacted me wanting help to shed light on the problems and solutions to help turn that number around. Walter Gibson considers himself lucky. He survived not one, but 2 strokes at his home in Osage County.
I didn't realize that I was having a stroke.
Because you didn't know the symptoms.
Yeah.
Not knowing he was having a stroke brings us to problem number 1 in Osage County. Not knowing the signs and symptoms of a stroke.
Probably make 2 to 3 responses for strokes per week.
Con Olson is in charge of the ambulance service in Osage County. One big issue he's noticed is people waiting to call 911. That's problem number 2, waiting to call for help. Every minute a stroke victim waits to call, the more likely they will be permanently disabled or die, which is why it's crucial stroke victims get to an emergency room immediately. However, in Osage County, that's not practical.
Osage County is one of the largest counties without a hospital in Kansas.
That's problem number 3. No hospital, and currently there's only 2 health clinics serving the more than 18,000 people in Osage County, which means stroke victims from Osage County have to be rushed to one of the hospitals in a city nearby, which is problem number 4, response time to getting stroke victims emergency help.
From the time they call 911, it could be 30 minutes to an hour to get into the ER.
In some cases, even farther depending on where a person is located in the county. Both times Walter had his stroke, he waited several hours.
But
he now struggles to remember things and has a tough time communicating.
I'll tell him it's no fun.
You can see the difference quickly getting help makes when you compare Walter's story to Ann Gray's, an Osage County woman who had a similar stroke, only she was in Topeka when she suffered hers.
I had immediate medical care, and in 20 minutes I was at the hospital.
Unlike Walter, she was able to recover quickly with no serious side effects.
But you really need to get in for that preventive health.
Ann's doctor, Tammy Patterson, says short of building a new hospital, the solution to fixing the problem in Osage County comes down to 2 simple things. The first, preventing a stroke by going in for routine checkups to see if you're at risk of having a stroke.
Especially those people that think, oh, this could never happen to me.
That list of prevention includes treating high blood pressure, quitting smoking, losing weight, exercising at least 30 minutes per day, 5 days a week, drinking in moderation, controlling and treating your diabetes and high cholesterol, and knowing your family history. The second solution, knowing how to spot a stroke, which can be quickly remembered by knowing the acronym FAST. F for face drooping, A for arm weakness, S for speech difficulty, and T, time to call 911. And it's not just crucial that everyone in Osage County be aware of the prevention as well as the signs and symptoms of a stroke. Take a look at this map now on your screen. Now, the counties highlighted are the CDC's top 10 deadliest counties for stroke victims in Kansas, and nearly all of them, as you can see, are in eastern Kansas. More proof it's on all of us to educate our friends, family members, and our coworkers about stroke.